In today's Health Watch, it is a rare but treatable cancer. Sarcomas affect both adults and kids, and it can happen in many parts of your body. July is Sarcoma Awareness Month, so we're bringing you some awareness right now. And joining me is Dr. Daniel Lerman. He is an orthopedic oncologist at Presbyterian St. Luke's. So, doctor, first and foremost, thank you so much for being with us. What is sarcoma?
Well, thank you for having me and giving me the opportunity and the platform to kind of share information about this disease. Because as you mentioned, it's a rare cancer. It represents about 1% of solid cancers experienced by people. But it is a cancer that disproportionately affects younger people. So we see it often in adolescence as people are growing. We see it in young adults, and we see it in people as they age. So oftentimes young people who develop a bump or a lump don't necessarily think they are at risk for having a cancer, and it can get ignored longer than we would like. So it's important to have an awareness about sarcoma so that we're cognizant of looking for things around our bodies.
Sure.
So as you asked,
go ahead.
Sarcoma is a cancer that rises in the musculoskeletal system. So it's a cancer that starts in either our bones or the soft tissue around our body, such as the muscles, nerves, and fatty tissue.
Is there any signs or symptoms we can be looking out for ourselves, like at home? And can you give us some optimism here? Is there treatment?
So there are signs and symptoms. And when we think about sarcomas, they kind of break down into two large categories. One, we think about sarcomas that originate in the bone. And sarcomas that originate in the bone are typically painful. And it's pain that occurs kind of at rest or at night, or pain that can awaken you from sleep, usually not pain related to physical activity. Sarcomas that arise in the soft tissue are usually painless, and they're painless masses that you may notice enlarging through your body. So people oftentimes get a false sense of security because they'll have a soft tissue mass or lump, and they'll say, oh, it's not painful, it's probably not cancer, when truly the opposite is true, meaning if there is a painful soft tissue mass, it is rarely something that's cancerous. So things to look out for are just being aware of your body and being aware if you have any strange aches or pains that don't seem activity related, that don't seem to be going away with rest, or if you have a new mass around your body that seems to be enlarging, and even if it is painless.
Sure. You know, we began. Oh, go ahead. Go ahead.
So you asked about treatments. So it is a very treatable process. And like any cancers, the earlier you catch it, the easier it is to treat. So we encourage people to have an awareness of themselves so that we can identify cancers early before they've spread to other parts of the body, and then we can treat that localized disease and cure the patient.
Absolutely. And, you know, real quickly before we let you go, we began this interview saying that it does happen in kids and adults. Is it more common in any age group?
So the overall incidence of sarcoma actually increases as we age. However, bone sarcomas, cancers that arise in the bone, we see a peak incidence around adolescence, so as people are hitting their growth spurts, so kind of our young teenage population. And so that's who we have to be cognizant of. And also, we do see another peak as people age into their 60s, 70s, and 80s. Okay, a lot of great information here, Dr. Lerman. So thank you so much for that information and that advice. And remember, you can watch all of our health interviews right now on CBSColorado.com.